Juvenile polyposis syndrome, or JPS, is a rare genetic condition characterized by the development of multiple benign polyps primarily in the gastrointestinal tract, particularly the colon and rectum. It's important to note that these polyps, while non-cancerous, can lead to complications, including bleeding and an increased risk of colorectal cancer in some individuals. In this video, we will explore the causes, symptoms, diagnosis, management, and long-term outlook for those with juvenile polyposis syndrome. JPS is typically inherited in an autosomal dominant pattern, meaning only one copy of the mutated gene from an affected parent can cause the condition in their child. The most common genes associated with JPS include SMAD4 and BMPR1A. Mutations in these genes disrupt normal cellular signaling pathways that regulate cell growth and differentiation, leading to the formation of polyps. While JPS can occur sporadically, the genetic linkage makes it crucial for family members to be aware of their risks. Symptoms of juvenile polyposis syndrome can vary significantly among individuals. Many children with JPS may experience gastrointestinal symptoms such as abdominal pain, diarrhea, and rectal bleeding due to the presence of polyps in their intestines. Sometimes, these polyps can become significantly enlarged, potentially leading to bowel obstruction. It's also possible for some individuals to be asymptomatic, meaning they might not show any obvious signs until routine screenings uncover the polyps. Diagnosis usually begins with a thorough medical history and physical examination. Since JPS often presents in childhood or early adulthood, healthcare providers may suspect the syndrome when young patients exhibit polyps during routine colonoscopy or barium enema studies. Genetic testing is a key component of the diagnostic process, helping to identify mutations in the associated genes, which can provide further insights into the individual's risk profile. Management of juvenile polyposis syndrome typically requires a multidisciplinary approach. The primary intervention is surveillance through regular colonoscopies, which allow for the detection and removal of polyps before they can develop into cancer. It's usually recommended that screenings start in early childhood, with the frequency depending on the number of polyps and any other symptoms present. In some cases, especially if polyps are numerous or causing complications, surgical options may be considered. Surgery can involve polypectomy, where individual polyps are removed, or in more severe cases, a colectomy, which is the removal of a portion or the entirety of the colon. Living with JPS also means being aware of the potential for other associated conditions. Individuals with JPS may have an increased risk of developing certain cancers, particularly colorectal cancer, as mentioned earlier. Monitoring for other types of cancer is essential as women with JPS might have a higher risk of developing gastric and often ovarian cancers. Therefore, regular screenings and a personalized healthcare plan are vital components of managing JPS effectively. While there is currently no cure for juvenile polyposis syndrome, advances in genetic research provide hope. Understanding the molecular basis of JPS is paving the way for targeted therapies and personalized medicine approaches that could mitigate the risks associated with this syndrome in the future. In conclusion, juvenile polyposis syndrome is a complex condition that requires ongoing management and vigilance. Awareness and education about the condition empower patients and families to make informed decisions about health screenings and lifestyle adjustments aimed at reducing risks. If you suspect JPS might be a factor in your or loved one's health, seeking advice from a healthcare professional specializing in genetic conditions or gastrointestinal disorders is a crucial step. Stay informed, and as always, look after your health. Thank you for watching, and be sure to subscribe for more educational content on important health topics.